Patient has a nice even gait with easy movement and good posture. Handshake was firm, eye contact was established. I introduced myself to the patient, explained that I would be doing a head-to-toe assessment on him, asked him his reason for seeking care, checked his armband for identification. The patient hears and understands me and I speak English, has no issues with vision, can sit, stand, and rise with ease, is mentally alert, and I can tell because he is able to repeat 3 unrelated objects such as dog, box, and couch. He is oriented to time and place, interested and involved with his care, dressed appropriately, shows no sign of shortness of breath, and appears to be of healthy weight. I have all my proper equipment, including the socks, tuning fork, temperature probe, a scent to smell and taste, a tongue blade, reflex hammer, something for soft touch, my pin light, Jaeger chart, and Snellen chart. To give the patient's history, I will ask about biographic data, including name, date of birth, occupation, gender, and marital status. I will get his reason for seeking health care by asking his chief complaint and assess that chief complaint for the history of present illness. I will get present medical information such as chronic illnesses that he may have, medications taken, and allergies. I will get past information by asking about recent surgeries, hospitalizations, accidents, immunizations, last exam, childhood illnesses, and etc. history. I will get family history by asking the patient about chronic illnesses that may run in the family, and social relationships. I will get personal information by asking the patient about personal status, illicit drug use, smoking, diet, environment, and functional ability. I will get psychological information by asking about health promotion, mental illnesses, and then I will get a review of systems by doing general symptoms, head and neck, integumentary, respiratory, chest. Review systems will include general symptoms, head and neck, integumentary, chest, breast, respiratory, cardiovascular, GI, GU, reproductive, musculoskeletal, and neural systems. Then I will get the patient's vitals, including blood pressure, temperature, respirations, pulse, pulse ox, height, weight, BMI, pain, visual acuity. I'll have the patient verbalize his height, weigh him with the bed scale, have him verbalize pain, and then use the Snellen chart for visual acuity. Then I will prep the patient for the exam, giving him a gown to change into, asking if he needs to go to the bathroom. And then I will start my assessment. When I'm taking pulse and blood pressure, I will be inspecting the hands for surface characteristics, temperature, moisture, inspecting for symmetry, testing cap refill, inspecting and palpating nails for cleanliness, clubbing, contour, color, consistency, shape, and thickness. Then I'm going to move the head and face. I'm going to inspect skull for contour, inspect hair for color and distribution. I'm going to palpate hair for texture, palpate the scalp, palpate temporal pulses, inspect facial features and symmetry, inspect bony structures of the face for side symmetry and intactness, inspect skin for color and lesions, palpate skin surfaces, facial bones, and sinus regions, and then I will complete an assessment of the cranial nerves, beginning with olfactory. I'll have the patient identify scent with his eyes closed and mouth closed. Then for optic, I will use the Snellen chart to assess near vision, but for peripheral vision, I'll stand in front of the patient, moving my arms, asking when he can see the movement of my fingers. For ocular motor, I will have the patient follow my fingers. So this will be ocular motor, abducens ocular motor, trochlear ocular motor, then ocular motor again, abducens ocular motor, and then trochlear ocular motor. Then I will move to the trigeminal nerve. I will have the patient clench his teeth while I palpate his jaw. Then for the facial nerve, I will have the patient identify a salty and sweet taste. For the acoustic nerve, I will have the patient participate in the Ryan test by putting this on his mastoid process until he can't hear it, moving it in front of the ear. And then the Weber test by putting it on top of his head asking which ear he can hear it loudest in. For glossopharyngeal, I will have the patient stick his tongue out, and I will assess for a gag reflex. For vagus nerve, I will have a patient say ah, and I'm looking for movement of the soft palate. For spinal accessory, I will have the patient push against my shoulders, or push against my hands when he shrugs his shoulders. And then hypoglossal, I'll have the patient stick his tongue out, move it side to side, up and down, looking for lesions and symmetry. Then I will move to the eyes. I'm going to inspect near vision with the Jaeger chart, and peripheral vision by standing in front of the patient, moving my arms, asking when he can see the movement of my fingers. Then I'm going to inspect eyebrows for distribution, underlying skin, and symmetry. Then I'm going to inspect the conjunctivae and sclera for color and clarity. Cornea for transparency. Then I'm going to move to the ears. I'm going to inspect external ear, palpate external ear, inspect the auditory canal, and palpate lymph nodes associated with the head. Then I'm going to move to the nose, mouth, and oropharynx. I'm going to assess nasal structure and septum. I'm going to assess the nose for patency, discharge, and symmetry. I'm going to assess the lips, buccal mucosa, and gums for moisture, texture, color, and symmetry, or skin characteristics. Then I'm going to inspect the teeth for number, alignment, hygiene, color, condition, and position. I'm going to assess the floor of the mouth and hard and soft palates for color and surface characteristics. I'm going to assess the oropharynx for anterior posterior pillars, tonsils, and uvula. And then I'm going to assess the tongue for symmetry, movement, surface characteristics, and color. Then I'm going to move to the neck. I'm going to observe symmetry and smoothness of the neck, trachea, and thyroid. And then I'm going to inspect the neck for range of motion, palpate carotid pulses one at a time, auscultate for bruits, palpate lymph nodes associated with the neck, and then assess for jugular venous distension. Then I'm going to move to the upper extremities. I'm going to inspect the arms for symmetry, skin characteristics, and deformities. I'm going to palpate the arms, elbows, and wrists for temperature, tenderness, and deformities. And then I'm going to palpate brachial or radial pulses. Then I'm going to move to posterior chest. I'm going to observe posterior and lateral chest for shoulder symmetry, muscle development, scapular placement, spine alignment, and posture. Then I'm going to inspect skin for lesions, intactness, scars, and color. Then I'm going to palpate the vertebra for alignment and tenderness. I'm going to observe respiratory movement for depth, excursion, symmetry, and rhythm of respirations. I'm going to palpate posterior and thoracic muscles for tenderness, bulges, and symmetry. I'm going to palpate posterior chest wall for thoracic expansion. Palpate down the vertebral column for alignment and tenderness. The costovertebral angle. And then auscultate posterior and lateral chest wall for breath sounds. should be 10 on the back. 3, 4, 5, 6, 7, 8, 9, 10. And then 7 on the sides. 1, 2, 3, 4, 5, 6, 7. Then I'm going to move to anterior chest. I'm going to oscillate the anterior chest for both sounds. There should be 8. Then I'm going to oscillate the heart for rate, rhythm, S1, S2, lifts, intensity, frequency, timing, splitting, S3, S4, or murmurs. So there should be 5 spots there. Then I'm going to, if it's female, I'm going to inspect breast for breast or nipple deviation, surface characteristics, contour, size, and symmetry. I'm going to observe breast tissue during movement for symmetry by having the patient put her arms above her head, behind her back, and then her hands together tightly, leaning forward. For males, I'm going to inspect breasts for breast enlargement, nipple discharge, lesions, size, and symmetry. For all patients, I'm going to palpate lymph nodes associated with drainage of the axilla and breast. I'm going to assess the anterior chest in a recumbent position with the patient's head elevated 45 degrees to inspect for jugular vein pulsations. And then I'm going to palpate anterior chest for thrills, heaves, and pulsations. Then I'm going to move to the abdomen. Normally I would have the sheets pulled up so the patient isn't too exposed. I'm going to observe skin characteristics from pubis to mid-chest for lesions, bulges, vascularity, scars, and navel. Then I'm going to observe abdominal movement, pulsations, and peristalsis. Inspect abdominal contour. Oscillate all 4 quadrants for bruits, vowel sounds, and venous hums. So I'm going to do bruits first. And then I'll do vowel sounds and venous hums. I'm going to palpate all 4 quadrants for tenderness, guarding, and masses. I'm going to have the patient then raise his head, inspecting or evaluating abdominal strength and flexion. Then I'm going to move to lower extremities. I'm going to inspect legs, ankles, and feet for tenderness, for skin characteristics, symmetry, hair distribution, deformities, and vascular sufficiency. I'm going to palpate legs, ankles, and feet for temperature, tenderness, pulses, and deformities. Then I'm going to test range of motion, motor strength, and sensitivity of the hips, legs, ankles, and feet. And then I will test deep tendon reflexes, including patellar, Achilles, brachioradialis, biceps, and then triceps. Then I will move on to the neurologic system. I will observe the patient moving from a recumbent to sitting position, noting coordination, ease of movement, and use of muscles. Then I'm going to assess gait, observing and palpating the spine for alignment while the patient stands and bends forward to touch his toes. Then I'm going to evaluate hyperextension, lateral bending, and rotation of the trunk. Test fine motor function and coordination of the upper extremities by having the patient alternate between pronation and supination of the forearms. Touch his nose with alternating index fingers with his eyes closed. And then I will test cerebellar and motor functions by having the patient walk heel to toe, stand on one foot with his eyes closed, and then stand on the other. Then I will have the patient position on his left side, with his right hip and knee flexed. And then I will perform a rectal exam to assess for anal sphincter tone and surface characteristics. And then I will note characteristics of stool after a lubricated gloved finger is removed.